Group dynamics and conflict resolution. As a healthcare provider, effective communication is important for building trust with clients and understanding their needs and providing optimum and tailored oral care. Clear communication enables healthcare professionals to educate about preventive measures, addressing concerns promptly, and develop treatment plans collaboratively. By actively listening and communicating with empathy, healthcare providers can enhance patients' compliance, resolve conflicts, and ultimately improve overall oral health outcomes for their clients.
We will be going over how to deal with client conflict and how not to deal with client conflict. Our scenario is Miss Curry is upset that she comes every 6 months for her cleaning and checkups, but was diagnosed with dental decay on the 1/6 MOD. She does not understand why it was not noticed at the last appointment. Her tooth hurts very much and she wishes that this was addressed previously. She declined radiographs at her last appointments.
Good morning, Miss Carrie. How are you doing today? How do you feel?
I feel not good today. My tooth hurting a lot on the upper right side, and then I'm really upset about it.
I'm so sorry to hear that. I'm just gonna let the dentist know and come and see you.
Yeah.
Hello, Miss Carrie. I heard you're having problem. Could you please tell me more about what's bothering you?
Well, I've been coming for the checkup and cleaning very regularly every 6 months, but right now suddenly I feel really pain on the upper right side, and I'm not really happy about that. I don't know why it wasn't noticed before.
I understand your frustration is scary, and let me look and see what's going on there. So, so it looks like there is indeed a decay in your first upper molar in the right side, and this can sometimes happens between appointments, especially if there is other factors like changing in diet or normal hygiene habits.
But why I wasn't noticed it before? I think I could avoid it if you caught it earlier.
Here is an example of how not to handle and escalate the situation.
I see that you're upset about the detection of the decay on your tooth. However, I must remind you that last appointment you declined to get any radiographs. And so if you did agree to them, we would have caught them earlier. We would prevent this from happening.
But the thing is, I come very regular for my checkup every 6 months. But why it wasn't noticed before? And my tooth is so much in pain now, and I think I could avoid it if it could address earlier.
Ms. Curry, it is not our responsibility to catch every issue since you didn't follow the recommendations that we made and you agreed that you don't want to take any radiographs last appointment.
But I trusted you guys to take care of my oral health, and now I'm in pain, and I feel like you guys blaming me about it.
I'm just stating the facts, Ms. Curry. If you want to avoid situations like this, you need to follow our recommendations forward.
Alright, this is not as unacceptable to me. I'm gonna find a dentist to take care of myself. I don't appreciate you guys treated me like this.
Suit yourself, Ms. Curry, but if you don't take responsibility for your oral health, don't expect to get a better treatment at somewhere else.
When dealing with conflict, it is important to never escalate the problem, blame the client, dismiss the problem, avoid patient concerns, losing your cool, ignoring expertise, neglecting documentation, and skipping follow-ups. It is important to avoid these behaviors when dealing with conflict because they can worsen the situation, hinder effective communication, and damage relationships. It's important to approach conflict with openness, empathy, and willingness to listen and work together to resolve it.
Dealing with conflict in a correct and professional healthcare setting includes active listening, client education, empathy, clarification, apology if necessary, accommodation, collaboration, compromise, offer solutions, follow-up, and lastly, documentation. Now let's go back and continue where we left off with how to deal with mysterious issues.
So, Miss Carrie, our dental hygienist will take care of you right now, and I'll come up and check you later. Okay.
I completely understand your frustration, Ms. Carey, and as you mentioned, regular checkups can prevent these situations from happening. However, tooth decay can happen in certain areas where it is hard to reach without radiographs, so we cannot confirm. And I recall at your last appointment you declined to have radiographs, and I'm really sorry that this happened. And the tooth pain and discomfort can make the situation really urgent. So how about we take the next steps to make this better moving forward?
Yes, I did decline the radiographs last time. I didn't know that it was necessary at the time too.
That is understandable. We respect our clients' choices. What about if we take radiographs today to detect any like different levels of the caries, because it's very important in order to prevent any further damages to your tooth and any more oral health diseases.
Thank you for explaining that to me. I really appreciate that. I will detect the radiographs now, and let's see what we need to be done.
Of course, and we'll make sure we take extra care of you today. And let us know if you have any questions or concerns so we can support you with any of that, okay?
I really appreciate that. Thank you for your patience and listening to me.
My pleasure. Your comfort and satisfaction is our top priority.
Thank you.
I'm just going to go get the dentist to come and continue the process of care for you, okay?
Hello, Miss Carrie. Okay, Miss Carrie, let's get started, and we'll make sure to address everything comprehensively in the future. And
The hygienist used empathy, active listening, and educated the client on the importance of radiographs and how they detect cavities under the surface and prevent oral disease, as well as how decay can develop in areas that are difficult to see. The dental hygienist also offers solutions and clarifications to deal with the conflict in an effective way.
Effective communication and conflict resolution skills are essential in healthcare settings for fostering trust, understanding, and patient satisfaction. By actively listening to patients' concerns, addressing them empathetically, and offering clear explanations and solutions, healthcare professionals can build stronger relationships with their patients, leading to improved outcomes and overall quality of care. Moreover, adept conflict resolutions not only resolves issues promptly, but also enhances patient-provider relationships and contributes to a positive healthcare experience for all involved. Ultimately, prioritizing effective communication and conflict resolution ensures that patients feel heard, valued, and supported throughout their healthcare journey. Thank you for watching.